morning, everyone. I'm Michael Sherar, President and CEO of Public Health Ontario. It's my pleasure to welcome all of you to TOPHC 2026, and thank you for joining us. Over the course of this morning, we will learn from one another, share our experiences, and explore new ideas. TOPHC remains a cornerstone of the public health community's annual calendar. Whether you're joining us for the first time or returning for our 13th year, it is your curiosity and engagement that will make this event a success. We're very glad you're here and grateful for the perspective you bring. And though we're connecting virtually, I would like to take a moment to acknowledge the rich Indigenous heritage that has shaped and underlies the lands, sky, and waters that we inhabit across Canada. We acknowledge and respect the treaty, unceded and traditional territories of all First Nations, Inuit and Métis people across Canada. We appreciate the life and health we draw from these lands. We respect the life journeys and worldviews of all Indigenous peoples, their practices, their ways of knowing, and their enduring presence across these lands. Toronto, where I'm joining you from today, is covered by Treaty 13 with the Mississaugas of the Credit and the Williams Treaties with multiple First Nations. Today, Toronto continues to be home to diverse communities of First Nations, Métis, Inuit, and urban Indigenous people whose legacy and rich cultures enrich this city. At PHO, our commitment to truth and reconciliation continues to guide our Indigenous strategy that prioritizes respectful partnership, stronger relationships, and tangible progress. Since we gathered last year, PHO has continued to make meaningful progress on our 2024-2029 strategic plan, which is guiding our work to strengthen Ontario's public health system. Many of you here today have been directly involved in that progress, contributing expertise, leading initiatives, and helping drive the improvements that are resulting in improvements across the province. I'd like to highlight a few advances across our 4 strategic directions. A major part of our momentum this year has come from our efforts to modernize the public health data systems, the work under Strategic Direction 1, Lead Provincial Public Health Data Transformation. One of the foundational pieces involves the development of a modern provincial immunization information system. And to support this, we've been engaging public health units and immunization partners to define the business requirements for this system. The work is critical to building a more connected, responsive, and interoperable public health data system for Ontario. We've also made strides in the work guided by Strategic Direction 2, strengthening laboratory leadership and advancing genomics for public health action. We have opened a new state-of-the-art genomics laboratory, equipped with automated platforms that dramatically expand our capacity for high-volume sample processing. We expanded whole genome sequencing for influenza A and B and for RSV, allowing us to better understand how these viruses evolve and circulate each season. And genomic testing is now more fully integrated into outbreak investigations for pathogens like Group A Streptococcus, Legionella, and tuberculosis, improving the precision and speed of public health action. These advancements strengthen Ontario as a leader in genomics-enabled public health. We also continue to put a strong focus on building workforce capacity, and this falls under Strategic Direction 3, advancing public health and health workforce capacity. This year, we completed a province-wide sector training survey to gain valuable insight into the evolving training needs of public health professionals helping to guide our future capacity building investments. And we've also developed a new curriculum framework that will guide practical, skills-based education at all stages of a public health career. Many of you have engaged in this work, and your insight has been crucial in shaping the learning opportunities that we offer. And finally, we've continued advancing the work under Strategic Direction 4, accelerating evidence to action and driving quality improvement. In partnership with Brock University, we completed a quality improvement maturity survey with public health units. And this is now informing next steps in strengthening quality improvement capacity across the province. And we launched a new provincial QI collaborative focused on improving food premises inspections, with 21 public health units actively participating. Co-design work and foundational training are now underway, setting the stage for implementation this coming spring. All of this progress reflects the strength of our partnerships and the commitment that each of you brings to this work. Whether you contributed directly to an initiative, participated in a survey, supported a working group, or helped guide thinking behind the scenes, your efforts are fueling the progress we're seeing today, and we thank you. I'd also like to take a moment to thank those who've helped us shape and build this year's event, including our TOPHC executive team, program planning committee, plenary and thematic panelists, presentation facilitators, and PHO's capacity building team. But before we dive right into today's sessions, I'd like to thank our partners that have helped make TOPHC a success. The Association of Local Public Health Agencies and the Ontario Public Health Association. The Association of Local Public Health Agencies, ALPHA, represents Ontario's 29 boards of health, medical officers, associate medical officers of health, and senior public health managers. ALPHA works with governments and other health organizations to advocate for a strong, effective, and efficient public health system in Ontario. And we also partner with the Ontario Public Health Association. OPHA provides leadership and advocacy on public health issues. OPHA's members have led change on a range of issues, including tobacco control, poverty reduction, increased access to oral health care, immunization, food security, and the design of walkable communities. And on behalf of PHO, I want to thank both ALPHA and OPHA for their invaluable contributions to TOPHC over the years. Now, about the day ahead. This morning, you'll have the chance to learn about the incredible work your peers have been leading across a full spectrum of public health practice. Throughout the day, you'll have opportunities to ask questions, discuss fresh ideas, and engage with one another. And I hope today provides a space to reflect on the challenges and successes of the past few years and gain new perspectives that will guide us forward. If you have any questions over the course of the day, please email topic.registration@oahpp.ca. It's now my pleasure to welcome Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Dr. Moore has dedicated his career to public health and has extensive experience in both clinical and public health leadership. Prior to his role as Ontario's Chief Medical Officer of Health, Dr. Moore served as the Medical Officer of Health for the former Kingston, Frontenac, Lennox and Addington Public Health Unit, where he played a key role in managing public health emergencies, promoting health equity, and improving community health outcomes. He's also a recognized expert in infectious disease control, epidemiology, and public health policy. Please join me in welcoming Dr. Kieran Moore.
Thank you, Michael, for that warm welcome, and thank you all for being here today. Good morning. I'm delighted to join you at TOPHC 2026. It's good to see so many of us coming together virtually from local public health agencies, academic institutions, community organizations, and research centers across Ontario and beyond. Each year, TOPHC creates space for us to connect, exchange ideas, and spark collaborations. In this spirit of collaboration and curiosity that really fuels progress. We come from different regions, disciplines, and perspectives, but we're united in a common mission, improving the health and well-being of the people in our communities. The work before us will continue to evolve. But if there's one thing this event affirms each year, it's that our strength lies in learning from one another and working together to meet new challenges, something this sector has demonstrated time and time again. We're facing a rapidly changing environment, one where public health challenges are shaped not only by scientific evidence, but also by the information ecosystems around us. The reality is that misinformation and disinformation continue to spread quickly and widely, undermining trust in ways that directly affect the health of our communities. Later this morning, a panel discussion will explore how we can meet these challenges together, because collaboration across the system is essential. No single organization can address this alone. TOPHC offers an excellent opportunity to learn, teach, and share. Right now, we are also seeing extraordinary opportunities emerge. Artificial intelligence is reshaping how we can analyze data, communicate with communities, streamline operations, and support public health decision-making. While technology will never replace expertise or judgment, it can strengthen our work when used wisely and thoughtfully. The opportunity lies in how we embrace innovation together, responsibly, ethically, and with a focus on equity and transparency. As with any powerful tool, thoughtful collaboration is what ensures AI strengthens public health rather than complicating it. As we move forward, I encourage all of us to stay open to new ideas, keep learning from one another, and work collaboratively to meet the challenges and seize the opportunities ahead. And that's the focus of the upcoming plenary titled Artificial Intelligence. It explores the transformative role AI is playing and encourages us to think critically and creatively about how we harness these tools responsibly and effectively to improve population health. To guide this important discussion, we're fortunate to have an exceptional colleague, Dr. Jessica Hopkins, Vice President and Chief of Communicable Disease Control at Public Health Ontario. Jessica oversees the scientific and operational activities of Public Health Ontario's Communicable Disease Control portfolio, a portfolio that includes medical and system support, operations and response, Indigenous strategy, and capacity building. Jessica has more than 15 years of public health experience. She was the Medical Officer of Health for Peel Region and Associate Medical Officer of Health in both Hamilton and Niagara. She is also a practicing family physician and an Associate Professor at McMaster University and Assistant Professor at the Dalla Lana School of Public Health at the University of Toronto. Her depth of experience and her long-standing commitment to strengthen Ontario's public health system make her a perfect person to guide this important conversation. Please join me in welcoming Dr. Hopkins.